Hello, good evening. It's PCOS Wednesday. Gonna wait for everyone to start coming in here. And tonight we're talking about headaches in general, but we're gonna talk mostly about menstrual headaches, which will affect women as they are in their menstruating years. So good night and welcome. Welcome everyone. We're gonna talk about menstrual headaches, and a lot of what I'm going to talk about does apply in general to men and women, and just some keynotes to understand about headaches, right? So I hope everyone had a good day, and thanks for joining me. I'm very aware that you guys could be doing anything else right now, so I really appreciate the company on this Wednesday night, so welcome in. And the first thing I would do is just define what we mean by a headache, right? A headache is basically any type of a pain that you may have in your head. But we're concentrating on migraines, and especially menstrual migraines tonight. So a menstrual migraine is one of several types of different migraine headaches. Examples of other migraines would be a migraine that happens with what we call an aura. So you experience some sensory or vision deficits and then the headache develops, or a migraine without an aura, and then chronic migraines. I will touch specifically on one type of other headache that's not a migraine, just so you understand what's the difference between the two, which would be cluster headaches. And that's important to understand. And I know we're going to have some men in here tonight, and men do have that more commonly than women do. And it's often confused between a migraine and a cluster headache. We also have tension headaches, sinus congestion headaches, headaches from high blood pressure. Anyone who's had any kind of a head trauma in the past is at risk for headaches as well. Sometimes, unfortunately, it's a sign of developing a brain tumor of some kind, and then any type of vascular disorder throughout your whole body, you may be affected by headaches as well. Any kind of chronic vasculitis, lupus, and those conditions. So even though there are different types of headaches, we will focus on the menstrual ones. Primary headaches are headaches that just have their own diagnosis, and then you have secondary headaches that happen as a result of other conditions that you may have. So I mentioned sinuses, high blood pressure, head trauma, those are secondary, and the primary headaches would be the cluster and the migraine headaches, among other ones. There's a lot of information on headaches that we're not possibly going to touch tonight, so I just condensed this a lot shorter to what you know, what you need to know. So it is estimated that 70%, this number is high, 70% of people who get headaches are women, right? And then out of these women, at least 2/3 of those women will go on to connect their headaches specifically to specific times rather in the menstrual cycle. Women who experience migraines will get them at least 3 times more than men do. Right? So those are important numbers, which means that everyone in this group right now tonight, at least 2/3 of us suffer with these headaches regularly enough. The menstrual headache or menstrual migraine is also known as a hormonal headache. And it's important to understand the following to know how to differentiate if that's what you're suffering from. It starts just before the period begins, so you're not having a period flow yet, but you have the symptom of the headache. And it continues, so it starts relatively about 2 days before your period, and then it continues until about day 3 of your period. That's a typical classic definition of it. The rest of the month you're fine, but 2 days just before your period starts, and then up to the 3rd day, you have these headaches. It is commonly described as a very dull throb or pulsation in your head. It can become increasingly severe. And then boom, the period comes, and then you understand, oh, I've had this headache for 2 days before my period. It has been described as severe, and it's really acute sensitivity to the light. Certain smells give you increased discomfort. You get nausea, you're very fatigued, dizzy, and the list goes on. But the typical definition of a migraine or hormonal headache is that it starts about 2 days before the period, and it ends about day 2 to 3, so about 5 days of discomfort, right? The symptoms are supposedly they last for a few hours, but most women will say that these last for days without relief. You go to bed with the headache, you wake up with the headache, and it just lasts for the specific time of the month. So What exactly is a migraine? So that's a migraine, menstrual migraine or hormonal headache. A migraine in itself is more than a bad headache. If you suffer with migraines and someone tries to downplay, oh, it's just a headache, it really is debilitating and a real chronic pain issue. In the United States, they estimated that migraines were the number one reason for sick calls in corporate America. Number one reason for decreased productivity is migraine headaches. And I just said about 70% of sufferers are females. So that would be the most common reason a woman may not make it into work would be a migraine. So it's more than just a bad headache. It's a neurologic disorder. It's a series of symptoms that are, benchmarked by debilitating pain. Menstrual migraines and migraines in general, they tend to be one-sided. So it's a one-sided pulsation, throbbing in the head. It gets worse, as I said, with movement, motion, light, smells, even sounds. It gets worse with those as well too. And the symptoms of a menstrual migraine, they are in keeping with the symptoms of other types of migraines. The timing of it is key. The other symptoms, you might feel very warm at times or cold, so your temperature is off. Sensitivity to light, noise, and smells. A scalp tenderness is a typical menstrual migraine, so your head feels tender. Even just combing up the hair, there's this tenderness just to that motion that worsens the headache as well too. Loss of appetite, decreased energy, you're dizzy, even your vision could be impacted when that headache is a blinding, throbbing headache. And remember, I just said it chooses a side. It's not typically a global headache. And then subsequently nausea, vomiting, upset stomach, and abdominal pain will happen. In rare cases, some women will have repeated cyclic episodes of diarrhea with fever as part of their menstrual migraine, but that's not a typical symptom. So the difference I want to mark is cluster headaches. Cluster headaches can mimic that of a migraine, but it's very different. Cluster headaches affect men more than women. Cluster headaches sometimes go missed because of the way that they happen. Men aged 20 to 50, right? It's a 30-year range there, will experience this more, right? The difference is cluster headaches occur in cyclic patterns or clusters. They are one of the most painful types of headaches, which is why people just call them migraines, but they probably are not migraines based on the pattern. So it strikes very quickly. They usually refer to this as a thunderclap type of headache. So it's usually a man. All of a sudden, this headache just comes on. There's no warning. There's no lead up to it, which a migraine, on the other hand, will have sort of a series of symptoms that I would go into leading up to the migraine. But the cluster headache, no warning whatsoever. So a cluster period is a time when this headache comes and it just comes on abruptly, and then it will last for weeks to months, sometimes a full year of almost daily headaches, which is why they sort of don't always identify it as easily. And it can last for that entire period of time. And then just like how it came on, like thunder, it disappears with no warning either, and it's relieved. And then you have a period of remission where you can go months to years without a headache. So that's the cluster headache. And the difference there is a menstrual headache, obviously women. Cluster headaches are typically in men, and the menstrual headache is related to the menstrual cycle, whereas the cluster headache can be daily and last weeks, months, even up to a year. And then all of a sudden, as suddenly as it came on, it leaves, and there was no real indication as to what triggered it. Triggers, the other thing to understand. A migraine, a menstrual migraine, typically is associated with certain triggers. Whereas a cluster headache, again, no warning, there's no triggers, no food caused it, not even stressful situations. It's not a life-threatening condition, but it could be quite debilitating. And as I said, men tend to have these cluster headaches. That's how we tend to differentiate them. And then the timing, they come in these periods of their lives where they would say, I had a year of death, like near-death headaches that came out of nowhere, and then they resolve themselves. They do warrant medical evaluations to just make sure that nothing else is going on. And also men who drink alcohol will realize during that cluster period that the alcohol is much easier a man will be more easier to experience a headache when he drinks alcohol or smokes. So the cluster headache is important to to note, because this cluster of headaches happens daily, and again, mostly men more than women, so it's not a cyclic occurrence. And a single attack can be as quick as coming on, like lasts for 15 minutes and then it dissipates, or it might last an entire day. And mostly the onset is at night. It tends to also wake you from sleep, this type of headache. And during the cluster period, the intensity is quite there. So there's no buildup like with a woman with a menstrual headache, as I said. It also tends to, after the attack, leave the individual very drained. Even though the headache is relieved, he is going to be drained and fatigued after this headache has just sort of slammed for several days on end with no relief. Cluster headache symptoms tend to affect the face, whereas migraines, especially menstrual migraines, it's more systems of the body involved. Cluster headache, as I said, strikes without warning, almost like a thunderclap. It's excruciating pain, and it's typically around the eye region. So it affects the face more so, but it's usually around one eye. It can radiate from that eye to the head, neck, and it tends to be a one-sided pain. So that's how we try to differentiate that. They get sweaty, that one eye can be tearing up, or tears flowing, also associated with a runny nose and one-sided. So that's important to differentiate whether you're having a cluster versus a migraine headache. Now, migraine headaches, again, women get them mostly, and 70% of women link them to their menstrual period. The menstrual migraines are related to changes in our hormone levels. The changes regularly occur throughout the cycle. And there are times in our cycles when both our estrogen and progesterone hormones drop to the lowest level possible. And this is just a natural occurrence as cycles roll through. These hormones are like waves of the ocean. You know, they're high levels and low levels. So these headaches tend to occur just before the period starts, because that's when both of these hormones are at their most lowest levels. And we also know, to back this up, that when a woman is pregnant, she tends to, by the second trimester, get a complete relief of all of these headaches that she would have been used to during her menstrual cycles. So during pregnancy, they tend to improve. Children and preteens get migraines as well too, and it's related again to the same low levels. And then, of course, women approaching menopause, when their hormone levels are lower, they get these headaches as well too. So the levels of estrogen dropping immediately before the start of your period is the cause of these headaches. They are also triggered, the other headaches I talk about was clusters. They don't need a trigger for cluster headaches, but migraine headaches are often triggered by stress, missing your meals, ladies, right? That's a common problem there. Caffeine intake, and many other reasons. So while migraines can start while you're in your childhood, menstrual migraines usually will not be a thing until you're actually starting your period, but we can see them in young teenage girls as well too, right? Migraines have stages to them. So the symptoms can begin 1 to 2 days before the full onset. And the symptoms are very vague, right? So leading up, you have a pre-migraine time where you might have food cravings, and it's typically always salt food cravings, which doesn't help with the headache situation. You also have bouts of depression. Remember, the hormones are dropping. Fatigue. On the flip side, you might be a bit hyperactive and restless, and excessive yawning, irritability. And as that headache is building, you actually for the first couple of days have a bit of a neck stiffness, neck difficulty. And as you tend to track these more and more, you start to see these cues that, hey, that headache is on its way again. After this stage, you may start experiencing problems with your vision. Your eyes are tired. You're trying to do your usual work. Your eyes are fatigued or blurry vision. Even difficulty with speech is a sign of onset of a headache, and difficulty with movement, and even hyper sensation as well too. And then the last and final stage is when you actually feel the excruciating pain, that throbbing pain of the migraine. Remember, I said there would be nausea, dizziness, sensitivity to light, sensitivity to sounds, especially pulsating sounds, flashing lights, flickering lights will trigger migraine as well. Feeling faint and fatigued, and all of this in the background of a constant throbbing that can last for days without relief. Now, In terms of the menstrual triggers, emotional factors first on the list: stress, anxiety, depression, and even excitement or just a sudden shock happens. That can be a trigger for a menstrual headache to begin. Physical triggers can also lead to migraines, which includes lack of sleep, poor posture, right? So you're straining your back, neck muscles, and then the headache is triggered at that point. So neck tension and physical overexertion. So you've pushed yourself a lot more than you needed to, and a headache can develop. Caffeine and alcohol are triggers as well. And then especially women who tend to chronically get migraines, you start learning which foods are your triggers. The most common criminals are chocolate. Even our friend dark chocolate can trigger migraines in some women. Wine, right? So these are all the good things, but these are the things you want to avoid probably in that 2 to 3 days before the period if you are a headache sufferer. Chocolate, cheese, wine, and citrus fruit as well for some people. The citrus fruit tends to be linked to more of an excessive acid situation, which will be connected with headaches as well too. Right, so those are the triggers. The caffeine and alcohol contributes to migraines, irregular meal times, dehydration. Also, being on a contraceptive pill, which is hormone, can trigger headaches depending on if the dosage is appropriate for you, and you need to discuss it with your doctor because you may need to switch your pill if you're getting menstrual migraines while on the pill. Strong smells are triggers, very stuffy rooms, secondhand smoke are triggers, and I spoke about flickering lights, very bright screens, and very loud noises as well are triggers. Screeching noises can be triggers where you experience that just very briefly, and all of a sudden the migraine is there for a few days. So how are the menstrual migraines diagnosed, right? The first thing I would recommend is to keep a headache diary, or what they call a migraine journal. Everything I spoke about talk about cycles and timing and triggers. So there's patterns that you would need to look for if you're suffering with migraine headaches that you're trying to pin down how best to deal with them. So you want to take note of what symptoms you get in your journal, how long they last, and what makes it better, what makes it worse. And once you get 4 of those things delineated, you start to get to understand your headache situation a bit more. So as you cycle through, you can reduce the severity of these headaches just by knowing what your symptoms are, how long they last, what makes it better, what makes it worse. Certain activities you want to log as well. Food stressors and triggers, you want to stress and food triggers as well, and what situations could have brought on your migraine. Certain types of workouts, certain types, again, dairy, cheese, wine. So keeping a log is important. Also, migraines tend to run in families, so it's a good idea to know, again, if you're trying to be diagnosed with migraines, if this is something that tends to run in the family as well. Your medical doctor can do some blood tests, screening kidney function, mostly liver function, looking for anything that underlying as an underlying cause for your headaches. Head CAT scan or CT scan, MRI of the brain, or EEG, which is that test where you see the little blip lines looking at your brainwave activity, become important based on the severity and how chronic your headaches are. Because forgetting your menses, there can be real underlying conditions that you might be suffering for that are exacerbated during your periods. So getting evaluated depending on the severity to look for other causes of your headache are important as well. Without going down the path of neurology, there are seizures that don't actually physically manifest as what we know as a clonic-tonic or a seizure, where you would actually have visible seizures. There are absent seizures as well, and sometimes if you've had an absent seizure, a headache post-seizure is something that you would recognize. So getting worked up is important, right? Remember if anything made your headache worse, and remember if anything made the headache better, and then you can sort of delineate if you need medications, if you need medical therapy, and what you can do about your headaches as well too. The treatment and prevention options may vary by the individual, But I want to stress that a migraine is more than just a bad headache. It's actually something neurological going on with you, and it really should not be tolerated. A menstrual migraine is not something you might just have to live with every month. Getting to the bottom of it and also trying to deal with it is important, because they can be debilitating, and there is enough evidence that it is the number one reason for women to have less productivity and to have sick calls at that time. So in terms of the treatment options, depending on the severity, it is a good idea to consider taking some form of an anti-inflammatory, or what we call a non-steroidal anti-inflammatory. These are the same family of medications a woman would use for severe period cramps as well. These, are best if they use about 2 to 3 days before the period starts, because remember, menstrual migraines are defined by starting 2 days or so before the period, and they last until you're 3 days into your period. So it's important to consider these, especially if your headaches are debilitating. So you would have like ibuprofen, Advil, Motrin, Aleve. And because you're only doing it for about 2 to 3 days, there is less side effects of, having upset stomach and intestinal side effects from using these medications, because you're just doing it for a short bit of time to sort of bring the headache threshold down, right? So for the 2 days before. A lot of migraines are linked to fluid retention. So you are bloated and you're hanging on to fluid, and that sort of happens around the time of the menses as well. So sometimes in severe cases, we may give water pills, which are called diuretics, to take water off of someone who really has a lot of bloating and water retention leading up to the period, which leads to the migraines. But in general, a lot of people do not need to take the water pills, and they have a lot of side effects as well. So in general, that time frame, you want to stay away from salt, and salt is hidden in many ways in our nutrition. So if you suffer from headaches, one of the first things you want to do is back off on your salt intake. So that in general reduces that bloat, that pre-period bloat that you will have as well too. In terms of the other options for treatments, sometimes women need to go on the pill for menstrual headaches, because remember, your hormones would be at their lowest threshold just before you start your period. So the 2 to 3 days before the period, your hormones go shoo, they fall. This headache comes on, ruins your life for about 5 days. So sometimes some women may go on the pill, but the pill in itself does have headaches as a side effect, so it's about finding a good balance. Caffeine-containing medications, a very popular one is Excedrin, tends to work for migraine headaches as well too. Just be very careful with the Excedrin. It's sort of a combination of aspirin and caffeine, and that can also be a bit destructive to the stomach lining as well too. In very severe cases of migraine, some people need to go on a short course of steroids to reduce the migraine discomfort as well too. Right, so women in menopause, similar to going on a birth control pill, may benefit from going on some form of an estrogen replacement. I usually try to stick plant-based at first if you could get away with it, because in the menopausal age range, to treat a headache with estrogen while taking on the risk of breast cancer and so forth, you have to find what makes sense. So I would usually do more of an evening primrose oil supplement for women who are suffering with headaches, and sometimes even just before the period, you can use that supplement as well to reduce the severity of your migraine headaches. In general, to relieve your symptoms, figure out what makes your headache better or worse, and that's where your menstrual migraine, your headache diary comes in. Just jot down what's going on. When did it happen? How long the symptoms? What were the symptoms? How long they lasted, and what made it better or worse? So figure out those headaches, and usually they have patterns to them, and that empowers you to address them as early as possible. You want to keep your blood sugar levels higher than normal. Now, if you're diabetic, this is not for you, but a lot of times with these headaches, your appetite is decreased. You're not eating as you should. Your hormone levels are down. So sometimes low sugar from not eating and skipping meals will contribute. So you want to eat small, frequent meals or snacks, which I call grazing. You want to just nibble and snack throughout the day. You want to do your granola and yogurts and little fruit, and not large meals, but trying to maintain a steady blood sugar is important as well. So if you're enduring a headache that's lasting these 5 days, 2 days before the period and then into the third day of the period, you would benefit from keeping a steady blood sugar level as well too. Right? Never miss a meal if you could afford it during that time when you're having these menstrual headaches. Missing your meals is not going to help anyone in that situation. And then start looking into organizing yourself to have planned times for relaxation and learn some relaxation techniques, because I talked about tension in the neck and pains in the neck. Pecking like a bird, yes, grazing like a bird. So you want to also start using more direct and targeted relaxation techniques and structure those meals as well. You want to avoid too little sleep, as I said, lack of sleep, but also you don't want to sleep too much, because that is a thing where these headaches are concerned. And I'm sure you can remember at some point where you may have slept for a very prolonged period of time and you wake up feeling actually worse than before. So that's something that was interesting as well. So too little sleep and also too much sleep can affect it as well too. So you want to keep a more regular sleep pattern, just as you do with the eating pattern as well. And stress is always going to be on the list in any discussion about headaches. You want to avoid stress when you can. Learn how to manage your stress. Give yourself the permission to walk away from stress if you're having a physical manifestation such as a migraine headache as well. So change your diet, look for triggers. Very commonly you want to back off on wine, cheese, especially those gourmet cheeses. A lot of them will trigger migraines and so forth. The wine has tannins in it, which will trigger that as well. And reduce your stress where best possible, right? Going on to more things to do to relieve your symptoms if you're actually having the headache. Drink water. 2 words, drink water. Lots of water. If you feel the early symptoms start coming on, just get your water close by, and you want to keep just sipping and drinking, because dehydration can lead to headaches and migraines most commonly. So drinking water will actually relieve your headache pain. And it's been shown to relieve a headache within 30 minutes. So the onset of the headache within 30 minutes, just water in itself can relieve that headache pain before you even reach for the medications that I just spoke about. That's the number one fix. Another one to know about is magnesium. So when you go to the pharmacy and you go to the supplement section, there's always a bottle just magnesium in it. A 500 milligram tablet of magnesium, to be specific. It's a good, quick and easy remedy for headache. Magnesium actually has been found to be one of the most effective remedies for headaches, and specifically for migraines. Now, be careful, because my magnesium can help you sleep easier. So definitely the timing of when you take it, and you don't want to have to make any major decisions and be the only one in charge of young children when you do some of these, because you will get a bit of a drowsy side effect with magnesium. And this is not a drug of any kind. It's just magnesium supplement, and a lot of times we have magnesium deficiencies because we don't get it much in our diet sometimes. And a low magnesium level affects PMS, premenstrual cramping, and specifically the premenstrual headache as well too. So the magnesium is important, and as I said, it's been found to be one of the most effective remedies. So it's drink water, and then you have your magnesium. So if you're a headache sufferer, it's a good idea just to keep some magnesium supplements. You may not need it every day or every day of the month, but the days when you are having your headaches, you can take it. So when you feel the symptoms of a migraine coming on, you can take the magnesium to reduce and downplay that pain. It also, as I said, helps you relax and sleep better. If you haven't tried it and you take magnesium, you wake up rested. It's not addictive. It's not a sleeping drug. It's a sleep aid, because a lot of times our melatonin, our circadian rhythms is impacted because we're not getting enough magnesium. So magnesium is a good one to reduce your headache and migraine symptoms. Next on the list would be to take a B complex vitamin, right? So I still haven't touched the medications hardcore yet. We're still drinking water, magnesium to help to sleep and reduce the migraine, as I just said. and then a B complex. The B complex should just contain at least, it's mostly about 9 of the different vitamin B's caps into one capsule. And that has been proven to be effective and also prophylactic as well against headaches. So if you're on a B complex on a consistent enough basis, you will start to realize that your migraine headaches are reduced just from doing that as well. It's an easy and cheap, cost-effective way to sort of treat migraines as well as prevent them. So that was number 3 on the list. Number 4 would be applying some form of a cold compress, right? So remember the stiff neck pain, discomfort, and then the headache. So even when you start getting that tightness, jaw tightness and stuff, you can start doing your cold compresses. The cold works to decrease inflammation. That's contributing to the pain symptom, and also would slow those nerves because it's neurological pain that you're having with a migraine. So it sort of slow how fast those nerves are firing. It's very simple, cheap. You get either you have those pre-freezing cold compressors, or you just get a Ziploc bag, seal it so it doesn't leak, ice blocks, wrap that with a towel, and you place it. Usually it's a good tool to rest, right? You dim your lights, you reduce as much noise as you can, and you try to use an application of a cold compress at the back of your neck to the temples as well for relief from your headache. That was number 4. So number 5 is my fave, which is yoga. Right? Yoga works. I'm not making that up. And start doing some yoga. That helps a lot with headaches as well. And then last on the list of your options at home would be ginger. Just like Granny used to make. You put ginger, boil some ginger tea, and you can use that and just sip that as well through as you're going through your headache as well too. So in general, you want to drink that water. Within 30 minutes of the onset of a headache, water works. Not making that up. And then, of course, magnesium was number 2 on the list. If you're a headache sufferer, look into that one. It's non-addictive. It does help with sleep as well too. Then the B complex vitamins, a cold compress, some yoga, try it, and ginger tea. In general, to avoid or prevent or reduce migraines, you want to, that week leading up to the period, you want to get adequate sleep. Even if you have things going on, you want to schedule that sleep in. You want to reduce or have no alcohol intake. And I'm going to sound a bit hypocritical here because I can't do it, but you want to avoid caffeine. And then monitor your diet. You want to track these headaches, what makes it worse, what makes it better. And then at that point, you kind of get an idea of what foods you need to avoid as well. What's important to know about headaches, I spoke about cluster headaches at first, which impact men more than women, but women get them as well too. If your headache comes on very suddenly, and it's important to understand if it's the worst headache you've ever experienced in your life, then you may need to call an emergency service or go into the emergency room to be evaluated if it comes on very suddenly and it's the worst headache of your life, because we don't know when or if someone may have an aneurysm in the brain, and that will present as an acute or sudden, abrupt, severe headache as well. And if you're not used to the headache of that nature, then you may want to be seen in the emergency room for a headache. Menstrual headache is more of a chronic cyclic occurrence 2 days before your period. It's back again. If you have a new onset severe headache and you've never experienced that level of pain in your life, then you should go to the hospital to be evaluated. If you have worst headache of your life, that's another reason to go to the hospital. If you have a headache after any kind of a head injury, so you've banged your head, you're in an accident, you fell, and you have a headache, could be a concussion, could be something worse, could be an intracranial bleed, you would want to go to the hospital for that as well too. If you have other neurological symptoms that you don't usually get with headaches, I'm talking numbness, difficulty speaking, slurry speech, you're confused and dazed, and not you or someone with you, you're noticing these symptoms, those are reasons why you would take them into the hospital, because this is more than just a headache. If they're losing their balance, loss of vision, mental confusion, there could be a seizure happening that you're not sure about. Numbness, tingling sensations, those are all reasons to go into the hospital as well too. And that's in general. For these menstrual headaches, downtime is important. You can schedule your life around your menstrual cycle and really work around some of these symptoms. You know, the ice compressors, you want to do massage, put cucumbers on your face, do aromatherapy, and understanding that as you learn your patterns, you probably will learn how to conquer these headaches as best possible. Right? So I think I did an okay summary without getting too technical. I also know that this is something that as you review the playback, you can get more details as well too. But I'm ready to take questions if anyone has any. Oh, we have a question. Great. Can they go away completely once the triggers are discovered? I would say probably not, because of the nature of the original cause, but the severity is much reduced. And let's say you know your trigger is wine, and if you're not doing the wine, you may still get a headache, but not anywhere severe as what the trigger is more of what gives it a bit of a kick, right? The trigger would give it more severity. The underlying headache can happen because these are hormonally driven, but the severity is much reduced once you know your triggers and you're strict with avoiding them. So that was a good question. Thank you. If anyone has any more questions, I'm free to answer those. Tonight we spoke about menstrual headaches. I did touch on cluster headaches because they're a little different. They affect men more so, men from age 20 and up. And they tend to happen in clusters, so weeks, months, daily headaches, and they tend to come on just like the rain did today, just all of a sudden, and then they leave the same way that they did, versus menstrual headaches that tend to go with a cyclic pattern. The menstrual headache happens because just before periods, both our estrogen and progesterone levels drop and we get them. So thanks so much. I need to definitely start tracking. So you know you have your period tracker apps. You want to plug those headaches in there as well too. You might see what happens around ovulation time, because that's another time when hormones tend to drop. And then pre-menstrual into up to day 3 as well. Definitely start tracking those headaches. And that's the best advice to try to get around them and reduce them as well too. Right? Any other questions from anyone? I hope this information is helpful to you guys, and just start implementing the advice where fit. The take home here was water, magnesium, B complex, cold compresses, yoga, right? And avoiding missing meals and so forth. So let me see, Avi says, do you get diagnosed by a physician? So yes, it's usually a good idea to get some formal workup at some point, especially the head imaging. You know, women get periods their whole life, but it doesn't mean they're immune to having other conditions, brain tumors, glands that are enlarged in the brain, optic nerve issues with behind the eyes. So getting an official diagnosis is important, and that usually includes some basic blood testing. Make sure there's no imbalances happening that could be relieved or resolved. So blood testing and head imaging, and then depending on the severity and other features of the headache, getting an EEG done to look for any undetected seizure activity is important as well too. And then a lot of these tests might come back negative, and then you can sit there and say, oh, it's my menstrual headache, right? So that was a good question. So if anyone has any more questions, I'll wait another maybe 3 to 5 seconds or so, and then I'll put this up on our IG. I hope you guys are enjoying these weekly sessions. Questions can always be asked under our posts as well too, and we'll try to answer them as best possible. And then everything I present I post as well, so you can review at some point, right? Thank you. Oh, and we have people now coming into the room. Thank you. So for those who just joined, I started at 8. So definitely you can, replay this live. It's going to be posted shortly after we finish. Some good information that you will, find valuable in terms of treating and preventing your headaches as well too. Right? So if there are no more questions or comments, I do want to thank everyone for joining us tonight. I welcome you guys every Wednesday. There's so much going on with a woman's body. that I continue to just have every week a new topic that's interesting for you guys as well. Right? So thank you and good night, and everyone stay safe. Thank you.